All right, everybody, we're going to get started. Welcome. I'm Molly Robb, the project coordinator for the California Evidence-Based Clearinghouse for Child Welfare, or CEBC for short. I'd like to thank you all for joining us and welcome you to the webinar. We've muted your phones due to the high number of participants attending, so if you're experiencing any technical difficulties or have any urgent questions, please use the Q&A pod located at the bottom right corner of the screen, and we will do our best to assist you. We will also answer questions after the completion of the webinar. Please also find the PDFs of the webinar PowerPoint slides and other webinar relevant materials in the bottom left corner of the screen in front of you. Lastly, you will receive an email with a link shortly after the conclusion of this webinar to complete a short and easy survey so we can continue to improve our webinars and make them as useful as possible. Now, a brief introduction of our presenters. Jared Martin is a research associate with the Chadwick Center for Children and Families at Rady Children's Hospital, San Diego. Jared's primary role is to support the CEBC's work on promoting guidance and resources on the implementation of evidence-based practices, which includes conducting trainings and webinars on implementation topics, providing technical assistance, and synthesizing the latest implementation research for CEBC website. Brent Crandall is a clinical psychologist and research investigator at the Chadwick Center for Children and Families at Rady Children's Hospital, San Diego. As a clinician, he has offered evidence-based treatments for children, youth, and families in varied settings. He supervises and trains therapists and co-authored the recently released book, Modular CBT for Children and Adolescents with Depression, a clinician's guide to individualized treatment. As a research investigator, he helped develop a new measurement approach to evaluate treatment outcomes in family therapy, and recently has been researching ways to screen and assess mental health needs for children and youth impacted by trauma. Through the California Screening, Assessment, and Treatment Initiative, Dr. Crandall is also working with California state and county leadership to develop policies and practices that enhance well-being for children and youth in California's child welfare and behavioral health systems. So now I will turn it over to Dr. Crandall.
Thanks very much, Molly. That was great. I appreciate the introduction. And I'd like to say hello to everyone. I appreciate you being here. And in particular, the unsung hero of webinars, those of you who are listening to the recording. And I call you heroes because it's a lot harder, I think, to come back and listen to the recording. So I'm impressed with your determination, and I'm glad you're here. So with that in mind, I'd just like to say I'm really glad to be here. I'm always excited to be involved in the California Evidence-Based Clearinghouse. The work that they do is spectacular. When I was working as a therapist, a family therapist, I use their site often, and so it's exciting to be part of this new rollout that they're announcing in this webinar. And before Jared gets into the details about that rollout, I'll be speaking for a little bit about evidence-based measurement, well-being, and child welfare. So kind of setting the stage and talking about the context for this change that is happening on the CEBC website. And measurement isn't always the most favorite topic to talk about at social settings. And since we've got a captive audience, I'm really excited to be able to talk about measurement because I think it's fascinating, and hopefully you'll find this presentation to be fascinating as well. There's three main topics I'll talk about. I'll first talk about measurement across time and disciplines. And then I'll talk about changes in child welfare and changes in measurement, how those things go together. And then measurement in child welfare, assessment, screening, and well-being, kind of drilling into what is the measurement, what types of measurement are being conducted in child welfare, and for what reason is measurement changing in child welfare to a slight extent. And that'll include discussing screening for mental health needs in child welfare as a model or an example of how those changes are happening. So, without further ado, let's go back in time, several thousands of years, to the Mesopotamian farmers who first gave us our early examples of measurement. Our earliest examples of measurement in history come from these Mesopotamian farmers several centuries BCE. And they would use units of measurement like as far as I can throw a stone. So they'd say things are 3 thrower rocks away, or as far as I can see while sitting on a camel. And people have referred to this period as a Babel of measurement, or in other words, everybody had a different unit that they were using of measurement. Some people could throw a rock a lot further than others. And so measurement was relatively imprecise, but it did show that measurement was a tool for these early humans, and something that was important to help them farm and do the things that they were trying to do. But obviously there was a need for standardization. So as time went forward, we kind of got closer to standardization. With the Egyptians, they came up with the cubit, which is distance from your elbow to the edge of your fingertips. And then the Greeks and the Romans were using the foot at this time. And so these were primitive efforts to standardize measurement, to make units of measurement more consistent. And so these approaches to measurement show that they were a little bit more precise than a throw a rock away, but still there was a lot of room for growth. On the other side of the globe, China, by 605 AD, was using measurement in a much more sophisticated way. They were using what's known as the imperial examination, which is an examination to determine who could be eligible for government leadership. And this approach to measurement shaped their government entirely in China. It helped move their government from a military focus to scholars with more class diversity being entered into their government system, and it helped their system flourish for centuries, really. And it was so effective it also spread to other Asian countries. But back in Western cultures, there was the Age of Enlightenment around the time of the French Revolution, and hard sciences or natural sciences really expanded as a result of this growth in measurement. And one of the early social scientists who explored measurement was Edward Thorndike. And what Edward Thorndike did is he opened up social science for measurement and really helped us become more precise about the way we measure social topics, things that have to do with humanity. Like for example, he was an experimental psychologist, and so his approach to measurement was that if it exists, if something exists, then we can measure it. It exists in some amount, so there's something that is measurable there, and if we measure it, we can know its quantity, we can know its quality, we can know it better. And so in his role as an experimental psychologist, he started measuring things that people previously didn't realize we could measure, and it really expanded the field of psychology so that we could measure things like IQ, personality, and that broadened into to behaviors and emotions, and it really led the way for psychology to use measurement as a tool, just as others had done previously in other fields. And this expanded beyond psychology, obviously, it went into social sciences. If we look at child welfare or social work, the way measurement took root in the field of social work represented the needs of the field. And so in social work, it was focused on poverty relief and social action. That was really the name of the game for that field. And so measurement in social work took on that mask, so to speak. It took on the guise of social problem measurement. And so there was large administrative, population, and policy level measurement that was used in social work, and that was the tool that would help them understand poverty relief, understand social action. And in this context, the field of social work continues to evolve. So now, if we look at child welfare as a part of social work, it's really become more clearly defined over the years, and there are three main topics or roles that are emphasized in the field of child welfare. Those are safety, permanency, and well-being. And if you're involved in child welfare at all, you've heard these three terms before and recognize them. As these things have expanded, it's also changed the role for child welfare workers. So today, the child welfare system and the staff within that system are asked to be part detective, part criminal investigator, part case manager, and part therapist. They're wearing several hats at once, and they're doing all these things in combination, which to me really means, if we wanted to summarize that, that means they're all superheroes. They're expected to be impervious to their personal biases, impervious to secondary trauma, impervious to the changing political pressures that might be on their system, and also the scrutiny that they experience as a result of social interest in the jobs that they're doing. So within this role of social workers, within this role of child welfare workers and these superheroes doing their jobs, in the last 2 decades, well-being has begun to be emphasized with even greater emphasis, greater importance. Health and mental health needs have become much more involved in their roles and in the part of the system. And it's easy to take for granted the significance of that shift. Obviously, we care about the well-being of these children, but to measure and to attend to that part of the system, that takes a shift. And that shift is ongoing right now. And just like the Egyptians and Romans, as the needs change, the measurement changes too. So child welfare services are for a particularly vulnerable population when it comes to mental health and well-being, and especially trauma. And so it's particularly important that measurement reflects this shift towards well-being, and that our measurement in child welfare settings is sensitive and effective for looking at the well-being needs of the kids in the system and the family. So that's the context that we're talking about when we talk about child welfare. But what we found is that this shift is significant, like I was saying. And in a national study that was conducted, a nationally representative study, excuse me, that was funded by the federal government, they looked at kids involved in child welfare. And out of 10 young people in child welfare with significant mental health needs, in 2012, what they found was that only a third of those kids were receiving mental health services. So out of the kids with need, only a third were receiving the services. And this is open to interpretation, and your interpretation is as good as mine. However, one thing that I gather from these results, and one thing that I take away from this, is that it's not realistic to ask workers to eyeball well-being, or to just wing it, or to assume that they're doing it already. We need to be careful not to underestimate the well-being aspect of child welfare and the well-being needs of the kids served in these systems. And even with a passionate workforce of superheroes in child welfare, which we have, we need to make sure that they have the tools to do their jobs effectively and efficiently and to address well-being. We're not going to send Batman out to fight crime without his utility belt, and we're not going to send case workers out to do their job unless they have the tools to really look at well-being and understand the well-being needs of kids in the system.